Okay. Hello. Good morning, everyone.
Good morning po.
Good morning po.
Long time no see, no? Ayan. Well, literally, yes, we haven't actually seen each other yet. But we have not met again, no? Since our first time during the course orientation. And so just put in the message box if you are not hearing me very well. And hello, everyone. There. Okay, so before we actually begin with our lesson for today, I would like first to admit all these. Wait. Okay. Okay. So let us all first pray the DLSM HSI prayer. Let us all remember that we are in the most holy presence of God, in the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Lord, today we celebrate your holy presence with one heart. In this Lasallian family, fill our hearts with the spirit, faith in our vocation. May we love one another the way you have loved us. Lord, today we celebrate your word. Through this one mission inspired by Saint John Baptist de la Salle, our commitment to the health, education, research, and care for the least and the less and the lost. Lord, we celebrate as one DLSMHSI, a whole where the experience of God is lived and shared. May we uphold the value of reverence for life in our service and communion. Bless us to commit to nurturing faith. Inspire us to commit to nurturing service. Strengthen us to commit to nurturing communion. Transform us to commit to nurturing life. Bless us to commit to nurturing faith. Inspire us to commit to nurturing service. Strengthen us to commit to nurturing communion. Transform us to commit to nurturing love.
Saint John Baptist de la Salle, pray for us. Leave Jesus in our hearts forever. Okay, so once again, welcome to you all to our class in pharmaceutical calculations. This is just our second meeting, no? It's very unfortunate that we have been delayed because of holidays, okay, and the start of the classes. Ayan. But I hope that all of you are doing well. Kumusta ang online classes so far, um, press that walang thumbs down button doon sa reactions. Yan, but you may press whatever reaction you would like to put in your Zoom. Okay, so nagkakahiyaan pa, no? Ayan, kasi mamaya sisihin. Okay. Yeah. Okay. So it is, no? It really takes a toll on everyone. But I hope that we manage our well-being as we m- move on to this new kind of normal. And hopefully by the next semester, we won't be doing this anymore, or we'll just have more of the asynchronous sessions rather than the synchronous sessions. Ayan. Okay. Um, for our attendance, okay, so I will do it differently again. I think I did it to you last time, no? For our attendance, I will be asking you a question, and I'd like you to respond um, in the chat box. Ayan, so put your message or your answer in the chat box, and that will be how I'll check your attendance. Okay? Ayan. So, here's my attendance question of the day. As it is the start, yeah, mahina, no? Okay, sige, sige. Salamat for that information. I will try to move this a little bit. Okay, how about this? Ayan. Better sound. Okay, thank you. Thank you for that feedback. Okay, so yeah. Ayan, so my attendance question for the day is posted. Ayan, it is posted in your chat box. Ayan, so as it is the start of Burr months, what would you wish for Christmas? And so I'll be giving you probably 2 minutes to put your answers in the chat box. Ayan. Para enjoy, di ba? Ayan yung attendance natin. Ayan. Just put your answers in the chat box. Your answer to the attendance question of the day um, will be my basis. No, if you are listening to this part of our class. Ayan. Okay. So I am seeing some answers now. Okay. You know, Filipinos kasi do celebrate Christmas as early as September. So we have this tradition that once it's the Burr months, you believe that it's already Christmas. Okay? Ayan. Para hindi boring yung attendance, no? Ayan. Mag-enjoy ako reading. I see that. Ayan. Reading your answers in the chat box. Okay? And so, I see a lot of answers already. Okay, so probably 1 more minute. Ayan, so be merrier, okay?
for all of us to be safe. Ayan, sana magkaroon na ng vaccine. But yes, I asked for a wish. So it could be something that may not be feasible actually with the timeline that we have. But yeah, do know that development of a vaccine is quite difficult. Yeah, so baka hindi yan dumating anytime soon. Okay, so keep it coming, guys. Ayan. So you may post it privately or just post it publicly, and I don't actually mind. Okay, so thank you for your participation, everyone. So I think that's the end of it. Ayan. Okay. So I do hope that all of your family will be safe during this time of pandemic, and I hope that we will be able to cope with the difficulties that we are currently in particular with your schooling, no, with online classes. I hope that you still somehow learn from your teachers, no matter what the situation is. And let's all pray that this ends soon, for all of us to be normal, or not to be back to what we were before, but to be better after this. Okay. Ayan. So once again, thank you everyone. Ayan. Yes. Okay. So before we proceed with our discussion, I will just try to remove some of the agio, no? Ayan. Because we have not met again since our course orientation. Ayan. So hopefully, um, maalala nyo pa yung mga sinagot ninyo. Okay? Ayan. So let's first have our Q&A session. Okay? Ayan. Okay, so I will be asking the questions, ayan, that you answered in our
Uh-huh.
pre-lecture. Ayan, in our pre-lecture um, guide questions. Okay, so if you would like to volunteer your answer, just raise your hand. If there will be no volunteers, I will be using the online roulette, okay, to see who answers next. Okay, so let's begin with the first question. So based on the videos that you watched in our online learning module, what are the most likely reasons that the physicians have illegible handwriting? And so anyone who would like to volunteer their answers? Okay, so I see Miss Kyla. Kayla, or is it Kyla? And what?
Kaya na po, sir, bahala.
Okay, so sige, Kyla na lang. Ayan, sige, si Kyla.
Apo.
Okay. So
For me po, ay, sige.
yeah, go ahead.
For me po, kaya minsan, wait lang, sir. Okay, aso. Ano po, for me po, kaya po illegible yung writings po ng physician. It's because marami pa po silang patients na ma-assess, saka um, kailangan po nilang ayun po, kailangan po nila ma-assess. At the same time, hindi po nila kaya mag-take ng time na much time po para magsulat pa ng maganda. Tawag dito, yun nga po, marami po siyang patients in line. Then, at the same time din po, syempre kapag med-school, marami rin pong kailangan isulat na notes na dinidictate lang ng mga professors po nila. That's why nasanay rin na po sila na mabilis magsulat. At the same time, hindi po gaano ayos yung pagsusulat po nila. prescription po or mga dapat po nilang gawin para mapabuti po yung kalagayan po nila. Yun lang po for me.
Okay, thank you for that answer, Kyla. Yeah, no, from the video that you watched, the uh, uh, it was mentioned, no, that there are actually many reasons why doctors most likely have illegible handwriting, no, and one of these reasons is basically it's a necessity, okay, because doctors normally attend to many patients at a time and they don't normally have enough time to write their notes and their prescriptions, or what we call the scripts, using very good handwriting. Okay? Ayan. So, yun yung isang dahilan. And I think Miss Sineres, Francesca, is also raising her hand. And so, Miss Sineres.
Similar with the previous one po, it's under time pressure.
Mm-hmm.
Like, every 1 hour po kasi, there's 100 of patients, ganon. And also, short form po, parang too much short form, or using of Latin abbreviation, which leads to deterioration po.
Okay, thank you for that answer, no, Francesca. Ayan. And actually, there are some chats in my private box, no. So because of the use of shortcuts, you are also correct, no. In fact, because physicians know that they are going to write to healthcare professionals, they would rather use the abbreviations and acronyms which only healthcare professionals understand. So that's why most patients um, think now they cannot understand what the doctors are actually writing, no. Ayan. So those are some of the reasons. Now let's move on to the next question. Okay, what do you think would be the problem when physicians have this illegible handwriting? Why should we may why should physicians actually try to make their handwriting more legible or more readable by patients and healthcare professionals alike? Ayan. So, okay. Tawag ako na iba. Ayan. So, si Ethan. Si Mr. Ethan Arcelia. Okay.
Hello.
Yes. We can hear you.
Okay. Um. So your reason po is that so that the patients will not get confused and they will not get the wrong medication prescribed by the doctor po.
Okay. Thank you for that answer. And I am also receiving some chats. Here, problems are increased risk in giving patients the wrong medicine. Pwede magkaroon ng misunderstanding or misinterpretation. For example, in the instructions, kung paano inumin yung gamot. Ayan, misinterpretation of dosage and medications. I see, sige, ask one more. Si Miss Danielle. Oh, sorry. Teka lang. Is this a Miss or Mr.?
Mister po.
Okay, I'm so sorry. Okay, so I'm so sorry.
Pwede po ma-compensate yung health ng isang patient po once na nagkamali po ng prescription yung isang physician po.
Okay, so thank you for that answer. No, again, illegible handwriting most often leads to medication errors because when even a pharmacist cannot understand a physician's handwriting, then it will lead to dispensing the wrong medication to the patient or telling the patient wrong instructions. So there will be a miscommunication or a misinterpretation. Okay. Okay. Thank you for those answers. Let's see. How about this? No. In your opinion, how does a pharmacist bridge the communication gap between a patient and a physician? Okay, so I will be asking Miss Michaela Jimenez.
Good morning po.
Hello, good morning.
So, babasahin ko na lang po yung sinagot ko din po dun.
Sure.
Okay. Pharmacists are responsible for providing drug therapy to patients. It is also their job to explain the effects of a particular drug, the right dose, and the best time to take it. Based on my observation, even the doctors explained all of this. The pharmacist also repeats it to the patient for a better understanding. And I think this is how pharmacists bridge the communication gap between the patient and the physician.
Okay, thank you for that very well thought out answer, Ms. Jimenez. And I believe many of you also answered very interesting responses in this particular question. Okay, yes, you are correct. Remember that a pharmacist is the most accessible healthcare professional to the patients or to the customers, okay, to the healthcare client, okay. Let's say there's a patient who's going to be discharged from the hospital. um, Normally, what happens is that the nurse gives instructions to the patient how medications are to be taken. Okay, those medications uh, um, which are brought by the patient, okay, to take for certain period of time. Okay, but if there are questions about how their medications work, what could possibly be the side effects of these, and how these medications are supposed to be taken, there's the pharmacist. Okay, so the pharmacist in the community is the most accessible healthcare professional, and you are correct. No, the pharmacist is able to bridge the communication gap between the patient and the physician by giving the patients information about the medication, particularly how the medication works, how it is supposed to be taken, and what are the telltale signs which require further check-up by a physician. Okay, so thank you for that answer. Okay, so let's move on to another question. Another question about your opinion. Do you think that a pharmacy student still needs to know some of the obsolete Latin-derived abbreviations, acronyms, and symbols? Why or why not? Okay, so I'll ask Miss Regina Angeline Patiag.
Good morning po, sir. For me po, yes, because those are part of the history and evolution of pharmacy, which can help us to understand more on how it started or on how it originated so that we can know more about the present of this field po.
I see. Okay, thank you for that answer, Miss
You're welcome.
Patiag. Okay, so Siri says you're welcome. Okay, so you are correct. No, it's part of the tradition. Okay, but not only is it part of tradition, many older physicians still use Latin-derived abbreviations, symbols, and acronyms. And for that, new pharmacists, no, the student pharmacists still need to know these, okay, because you don't know what particular type of doctor you will encounter in your practice. Okay, if you do not have any prior knowledge about these Latin derived abbreviations and symbols, then you might make a mistake in dispensing the medications. Okay, however, do remember that there are already recommendations about what acronyms and abbreviations need not be used. okay, in writing prescriptions. And we should actually be the one who leads, okay, this change in culture in the healthcare system, um, to ask our physicians to not only legibly write their instructions, but also to use those abbreviations and symbols which are not error prone. So we will be discussing about error prone abbreviations, symbols, and those designations later on in this lecture. Okay, so I think we are able naman to address some of the questions that I put as your pre-lecture questions. We'll answer the last one when we get to that point. Okay, ayan. So thank you very much for your active participation. Okay, ayan. So now, it is not yet a very common practice in many community drugstores to use these, no, what we call the auxiliary labels. Right? Um, we recognize, okay, that some instructions by the physicians are not easily understood by the patients. Okay, have you ever encountered a time, or have you ever experienced a time when you bought a medication and then binigay lang yung gamot sa'yo without any information about how it's supposed to be taken? And so anyone who's experienced it, and just I will not call you naman. Just I just want to see reactions. Ayan. Bumili ka ng gamot sa drugstore tapos wala man lang instruction about how these medications are supposed to be taken. Ayan. So I see hands raised. Okay. Okay. So yeah, it happens a lot of time. Okay. A lot of times. So how do we actually prevent medication errors if we do not tell our patients how medications need to be taken? Okay. One of the methods is by putting auxiliary labels. Okay. These auxiliary labels bear instructions which are easily understandable by the patient. For example, is this medicine supposed to be taken with food, without food, or before getting your meals? Is this supposed to be taken at night? How many tablespoons or tablets are you supposed to take in one dose? Okay, and so this is just one of the many mechanisms by which community drugstores can actually improve um, the delivery of healthcare service to the patients by putting auxiliary labels. Okay, so now let us move on to interpretation of prescriptions and medication orders. Ayan. So before I proceed, no, let me just reiterate the learning objectives for this particular lesson. So at the end of the topic, the student should be able to recognize the format and components of traditional prescriptions, e-prescriptions, and typical institutional medication orders. Number two, to differentiate the structure and contents of prescriptions and medication orders. Number three, to interpret correctly standard abbreviations and symbols on prescriptions and medication orders. Number four, apply knowledge of basic pharmaceutical Latin in interpreting common abbreviations and symbols used in prescriptions and medication orders. And finally, number five, to evaluate a prescription and medication order by identifying errors, omissions, and error-prone abbreviation symbols and those designations. Now, you may wonder, do we actually need to know all these objectives? Perhaps this will be the first and the last time that I will be reading the objectives. And so I just want to reiterate that how I will assess you will be based on these learning objectives. So whenever I present to you in the online learning modules, the learning objectives, please take note of these learning objectives because these are our minimum requirements. So the student assessments that I will be giving you will be based more on these objectives. Ayan. So let's begin with the most basic information that you need to know. And it's parts of prescriptions and medication orders. Ayan. So first, let us define what a prescription is. So remember that a prescription is a written order of medication that is issued by a physician, a dentist, or other properly licensed medical practitioner. For example, even a veterinarian can provide or can write a prescription. Now, you may ask, is a pharmacist able to write a prescription? And so, have you ever heard of prescribing pharmacists? Never. Okay, never. Yeah, why do you think so? Bakit kaya in the Philippines we don't have prescribing pharmacists? Yes, di ko alam kung hindi lang niya na-lower yung hanya, no? Pero sige, Miss Patiag, Miss Regina. Ah, okay. Hindi lang niya na-lower. Okay, that's okay. Ayan, so there's an answer here, no, from Kayla. Ayan, kasi dispensing lang po ang ginagawa ng pharmacist, no? Any other idea? Ano yung, ano kaya yung dahilan? Why prescribing is normally localized on physicians, dentists, veterinarians, whereas dispensing um, is for pharmacists. Any idea? Okay, sige. Maghanap tayo ng volunteer. Okay, ayan. So, okay. In my other, ayan. So, I would like to ask Miss Maria Althea Belen. Okay,
Sir,
there's no right or wrong here. Okay, there's no right or wrong answer.
kasi po yung mga doctors po, mas may more knowledge sila on how yung prescription po ng drugs are made kasi dumaan na po sila sa med school. Unlike yung pharmacist po, 4 years 4-year course lang po. Then need pa po ng further study para po makapag-prescribe ng gamot.
Ah, okay. However, with that answer, no, again, there's no right or wrong answer here, no. I still recognize your answer, okay, but there's a big but here. Okay, ayan. So, of course, we are pharmacists. You are going to be pharmacists in the future. Okay, do know that all healthcare professionals are supposed to be equal in the eyes of the patient. Okay, there's no one that is above one profession, whether you are a rad tech, whether you are an occupational therapist, you are a physical therapist, a nurse, a doctor, a pharmacist. All of you are equal. And you just do different jobs, you contribute differently in the provision of healthcare to individuals. Okay, ayan. There is a deeper, okay, reason why only pharmacists, only physicians prescribe. Ayan. Tapos, sige, before I say it, tawagin ko muna si Miss Hennessy Franny.
Um, Hello po.
Yes, I can hear you.
Di ko po sure, try ko lang po. Pero is
Yes.
it because po, doctors, like what Thea said before, doctors have more knowledge and they specialize on more, uh, they have certain specializations and they can examine the patients more thoroughly than
Okay.
pharmacists. Yun po, yun.
Okay, so what I can take from your answer is that it's because number one, physicians diagnose. Okay, physicians know about the condition of the patient, but do remember that pharmacists are supposed to be drug experts. Okay, so you will be a professional who knows more about drugs than any other profession. Just like, let's say, a nurse. A nurse is the one that is who is expert on administering medications. Okay? Yan, kumbaga iba-iba tayo ng specialization. Okay? So, you cannot just say that one is better than the other. Okay? Yes, okay. So there's actually an answer here, no, in the chat, because pharmacists are professionalized only by knowing and studying drugs and not accessing. Okay, I think what you mean to say is diagnosing the patient. Yes, you are correct. Okay. Sige, ito kasi yun. It's for check and balance. Okay, ayan. So imagine a world where there's only one person who is going to diagnose you, to prescribe you, to prescribe you medications and to dispense to you medications. Okay? Imagine if that power lies only on one person. Okay? There will be nobody who checks whether the medications are correct and appropriate for the patient. So we, as pharmacists, are there supposedly, okay, to be the check and balance for doctors, okay, because any other healthcare professional can make a mistake, okay, and remember that our goal is to provide healthcare and therapy to patients. Okay? Sa pharmacist talaga, ang ating focus is of course drug therapy. So, yun, no? That's the reason why we don't have a prescribing pharmacist as well, no? Just like walang dispensing doctors, okay? Kasi pinagbabawal ng batas yon, okay? Ayan, mawawala kasi yung mag-monitor sa isang profession. Okay, but in the United States and other countries, there are actually prescribing pharmacists. Okay, but it's only localized. No, it's only limited to certain practices. For example, in emergency medicine. Okay? Kasi nga naman, emergency. Okay? So, kailangan ng immediate na action. Okay? So, thank you then for your response, Miss Kyla. Ayan. Okay. So, what are in your prescription? Okay, so in your prescription, you have the specific medication and the dosage to be prepared by a pharmacist and administered to a particular patient. Now, there are actually different forms of a prescription. Okay, there are those prescriptions which are written for a single component or prefabricated products. These are the commercially available products that can easily be bought or purchased by the patients from a drugstore. And these medications do not require compounding. Okay? Ayan. So for example, yung mga common, okay, that you see, for example, a prescription that is for metoprolol, which is a medication used for hypertension, or let's say a prescription for an antibiotic. Okay, yun. So those are examples of prescriptions written for a single component or a prefabricated product. Okay, so meaning to say all those medications written in the prescription are already available commercially, and the pharmacist need only to dispense those medications. Now, there are also those prescriptions which are written for more than a single component and requiring compounding. Okay? Ayan. So, what are these? No? Do we actually have this? Okay? In the past, okay, nung unang panahon, mga 1800s, 19th century, um, apothecaries or pharmacists, actually in other countries, we are actually called druggists, no? Drugista. Ayan, so druggists. Pharmacists do measure components or ingredients and mix these components together to prepare a medication specific to a patient. Okay, so when there is compounding, most often it is a personalized medication for a patient. Okay, now remember that pharmacy compounding involves the following processes: mixing, assembling, packaging, and labeling of a medication upon receipt of a prescription for a specific patient. Okay. Now, do we actually have this? Okay. Currently in practice, we have very limited, okay, practice of pharmacy compounding today. Okay. In fact, you will most often see pharmacy compounding in prescriptions coming from dermatologists, okay, yung mga dermatological products that require compounding or mixing by the pharmacist, okay? Ayan, so let me give you an example. Let's say a patient has a milder form of an acne, okay? And the treatment, okay, for that condition is not available commercially. Okay? So, kunwari kailangan niya ng certain anti-inflammatory cream and a certain antibiotic. Okay? Now, the dermatologist can actually request the pharmacist to mix the components, to mix certain ointments to provide for the patient. Okay? Yeah, that's one example of pharmacy compounding that we have today. There's another one. Remember that pharmacy compounding is for a personalized medicine. Okay, so meaning to say the medicine is supposed to bear a dose that is specific for a particular patient. Now, this also happens when the patient is a pediatric patient, let's say an infant. Okay. I've experienced this before when I was an intern in Mercury Drug Corporation, Mercury Drug Store before, Mercury Drug Corporation, MDC. Ayan. So, um, here, no, the prescription will actually contain instructions for the pharmacist to prepare what we call paper tabs or papelitos. Okay, so what are these paper tabs or papelitos? Now, let's take for example a medication for the heart. Okay, let's say it's Lanoxin. Lanoxin is actually the brand name for digoxin, or kung medyo maarat ka, digoxin. Ayan. So, yung digoxin, okay, it is actually a medication for the heart. Now, that medication is very potent. When we say potent, these are medications which at very low concentrations or very low amounts can actually cause toxicity. Okay, ayan. So they can be effective in very low doses. Ayan. So ibig sabihin pag na lagpasan yung therapeutic threshold na yon, they can be toxic. Okay? So yun yung ibig sabihin ng potent. Now, this medication, yung digoxin, is normally given to older people, no? Ayan, pang adults siya. Now, if a patient is an infant, okay, the physician will compute the proper dose for the infant based on the infant's body weight. Okay, ayan. Now, the medication, that particular dose, is not available in the market. Okay? So, no problem. Okay, so what will the pharmacist do? So the pharmacist will actually crush, okay, a number of tablets and divide these powdered tablets, no, yung tinatawag nating um, pulverized tablets, okay, to prepare paper tabs. So papaliitin natin yung dose. Okay? So that is also an example of pharmacy compounding that we still have today. Okay? Now, for pharmacy compounding, normally hindi ito pine-prepare in large amounts in advance. No? Ayan, for example, in the US, the FDA or the Food and Drug Administration only permits advanced preparation of limited quantities of compounded products to anticipate the historical amount of medications that are normally requested from the drugstore. Now let's move on to the parts of the prescription. Right? So here's an example of a hypothetical prescription. Okay, so what are the things that you need to look for in this prescription? Okay, so number one, you look for this. Okay, so you look for the prescribers. Okay, wait a moment. Lalagyan natin ng annotation. Yan. So you will look for this. Okay, so the prescriber information and the signature and the prescriber's um, license number. Okay? Ayan. So, of course, this verifies that the prescription indeed came from a licensed and registered physician
Mm-hmm.
or similar healthcare professional.
I found this on the web.
I wait a moment. Okay, there you go. Okay, so after that, there's the patient information that you need to look for. Okay, so the patient information includes, of course, the name of the patient. What are not written in this hypothetical prescription ay yung mga important information of the patient that should also be present in the prescription. And those are the patient's age, the body weight, okay? Sometimes the sex, oops, the sex or the gender of the patient is also written in prescriptions, okay? Why should the patient's age and body weight be written in a prescription? Now, just like what I mentioned before, okay, certain medications only apply to adult individuals, okay? If this particular medication is not intended to be used, let's say by an infant or a toddler, then there could be a problem. Okay, so maaari pa rin magkaroon ng medication error. Okay, so we need to know the age of the patient. And not only that, we also need to know the weight of the patient, especially if the patient is a pediatric patient. Okay. because there are certain medications which need to be computed, whose doses need to be computed based on the body weight of the patient. Now, let me give you an example from my experience. Okay, um, a disclaimer: I have not been a pharmacist in a drugstore or in a hospital. The only dispensing experience that I have is when I volunteer as a pharmacist in medical missions. Okay, but nonetheless, I do see some problems about this. Okay, um, there's this occasion when I received the prescription. Okay, it's just paracetamol. Yun yung nakalagay, no? Paracetamol 500 milligrams. Okay. Now we know that paracetamol is an analgesic, antipyretic. Okay. Now it was a mother who gave me the prescription. So I asked the parent kung siya ba yung nakasulat na yung mother, no? Tinanong ko siya kung siya ba yung patient na nakasulat doon sa prescription. Tapos sabi niya, "Ay, sir, hindi po. Sa anak ko po 'yan." "Ah, ganun po ba? Yung anak niyo po ba ay umiinom ng tableta?" Ayan. Kasi ang sinulat ng doktor ay tablets, okay? Yan, tapos sabi, "Ay, hindi sir, 2 years old pa lang po yun." Ganyan. Hala ka, di ba? Ayan. So, there's a problem. Okay? Ayan. So, what I did, okay, normally what you should do is you should ask the physician. Okay? You should ask the physician some clarification about the prescription. But since it's a medical mission and paracetamol is not really a prescription medication, parang I took upon myself to actually determine the appropriate medication for the patient. Okay? Ayan. Pero hindi yun normally ginagawa. Okay? Ayan. So, it's just a different occasion. So, because of that, no, I asked the parent kung maaari na ba yung uminom ng syrup yung anak niya or dropper. Okay? So, that's the time that I actually decided to give the appropriate dosage form to the patient. Okay? So, ganoon, no? Ayan, minsan talaga makakaapekto yung um, patient age and body weight in verifying the correctness of the medications written in your prescription. So you should also look for those. Okay. Now, there's also the date that the prescription was written. Okay, so right over here. Now, with regards to the date of the prescription, normally, ano ba yung ating ginagamit na standard? It depends, no? Ayan. So medyo iba-iba yung standard on this. It can be valid, no? Your prescription can be valid for as long as 12 months. Some are only valid for 6 months, okay? Others only for 1 month. While for other medications, it should be valid only within the time frame that is scheduled in the prescription. Okay, so what am I talking about? Let's take, for example, a medication for a prescription for a maintenance medication. Okay, so when we say maintenance medication, it is actually a drug that is taken repeatedly by the patient for long periods of time. So examples of medication of maintenance medications are those that are for hypertension, for diabetes, for high cholesterol level or hyperlipidemia. Okay? So if you have parents or grandparents who are taking these medications, you would know what I am talking about. Okay? Now, because the patients are going to take the medications for a long period of time, normally the doctor will write in the prescription the number of refills, okay, that are allowed for the prescription to remain valid. Okay? Let's take, for example, this hypothetical prescription. Okay? So according to this, meron diyang refill 6 times. And the number of tablets that are required to be dispensed ay 30 tablets, meaning good for 1 month. Okay? Ano yung ibig sabihin nun? This prescription is valid only for 6 months. Okay? Ayan. So, para saan yung validity? Okay? Now, the validity ensures that at the end of the validity period of the prescription, the patient goes back to the physician for monitoring. Okay? So, mayroon kasi mga conditions that require the patient to constantly communicate with the physician to ensure that the medication works for that particular patient. Okay? Yung iba nga, 1 buwan lang ang validity ng kanilang prescription. Ibig sabihin, no refills. Okay? It only means that the patient needs to go back to the physician after maubos yung medications listed in the prescription. Okay? Ayan. So, yun yung purpose noon. Okay? Para magkaroon ng um, monitoring and check-up of the patient. Now, there's another example. Let's say antibiotic. Okay, yan. Ang mga Pinoy mahilig kasi sa pasahan ng prescription. Okay? Gumana sa'yo, baka gumana sa kanya. Okay? Ayan. So, that happens a lot of times here in the Philippines. Now, remember that antibiotics are not supposed to be shared. Okay? What you are feeling right now may not be the same as those that are being felt by people around you. Okay? Na may similar conditions. Okay? Ayan. So, normally, the prescription for antibiotics is only good for the duration that is written in the prescription. Okay? So, for example, may nakasulat na antibiotic. Okay? Tapos, sabi doon sa antibiotic, dapat siyang inumin for 7 days. Okay? You look at the prescription. Okay? At least, hindi siya lalagpas ng 1 or 2 linggo. Okay? Otherwise, magtaka ka na. Okay? You may ask, kailan nyo po ba naramdaman yung sakit? Bakit ngayon lang kayo bumibili? No? Imagine a patient going to a drugstore, okay, with a prescription for antibiotics. Tapos, yung date in the prescription ay 6 months ago. Okay? Ayan. So, dapat ikaw as a pharmacist, you already realize that this prescription is not intended for that particular condition that is being experienced by the patient. Okay? Ayan. So, kasi nga naman, kung meron kang prescription for antibiotic, you should immediately purchase those medications or that medication kasi nararanasan mo siya. Okay? So, kaya ka nagpa-diagnose, kaya ka nagpagawa ng prescription because you are feeling something that needs to be treated. Okay? Now, if the prescription is way beyond the time period stated in the dose regimen, magtaka ka na, no? So, baka repeat yung prescription, no? Ayan yung luma niyang prescription, inuulit niya lang, okay? What's the problem with that? When you take antibiotics without the proper guidance of a physician, okay, without proper diagnosis of the condition that you are feeling, pwede itong mag-lead to antimicrobial resistance or antibiotic resistance. The next time that you take antibiotics, these may no longer be effective to you, okay? And you may require much potent or more potent or higher level antibiotics to treat your condition. Okay, so again, pag antibiotics, pag more than a month, okay, uh, yung date na nag-lapse in the date of the prescription, you should immediately call the attention of the patient Ayan, ask the patient kung kailan niya ba talaga naramdaman yung kanyang sakit. Okay? Ayan, hindi pwedeng itago yung mga ganyang prescriptions. Okay? Okay. Now we move on to the next parts of the prescription. So the RX symbol that you see here, ayan. So this RX symbol, and the RX symbol is your superscription. Okay, so the RX symbol is actually a symbol for the Latin word recipe. Ayan, or kapag nagluluto ka, recipe, no? Ayan, pero dahil Latin ito, recipe. Ayan, so recipe, which means to take thou, or you take. Okay, this marks the start of the list of medications for the patient. Now, after this, we have the inscription. So the inscription bears the name of the medication and the dose of the medication. Okay? Ayan, the dosage strength of the medication. Now, what you are seeing here is Lipitor. Lipitor is actually a brand name. Okay? In the Philippines, it's not allowed because we have what we call the Generics Act of 1988. All physicians are required to prescribe using generic name. Okay. Um, Lipitor has a generic name that is atorvastatin. It is actually an anti-hyperlipidemic drug, meaning to say it is used to lower cholesterol levels on patients who have high cholesterol levels. Okay? Ayan. So, just clarification. So, this is your inscription. Okay? Ayan. Now, inscription, yun yung list of medications for the patient. Then we also have the subscription. The subscription, ayan, bears the instructions to the pharmacist. Okay, ayan. So, ang nakasulat lang naman dito ay tabs number 30. Okay, but how do we interpret this? Okay, we interpret this as dispense 30 tablets. Okay, ayan. So, basically, yun lang yung ibig niyang sabihin. That's the subscription, instruction to the pharmacist. Then below it, we also have the signa. Okay, so the signa um, bears instructions for the patient. And normally, this part of the prescription is the part of the prescription that needs to be clarified to the patient. Okay? Kasi normally, if the physician uses acronyms and abbreviations in the signa, the patient will not understand those instructions. So the pharmacist needs to clarify the instructions to the patients, either by writing the instructions in the medication itself. Let's say, for example, in the box, by using auxiliary labels, just like what I showed you before. Or if the medication is not for a prescription medicine, okay, the pharmacist can simply write the instructions in the prescription. Okay. Now remember, class, that prescriptions for prescription medicines, okay, which we will discuss later on, need to be taken, okay, by the pharmacist. Okay, tinatago talaga siya ng pharmacist for monitoring by our Food and Drug Administration. Okay? Ayan. So, actually, naranasan ko yun when I was an intern. No? Nagre-record ako ng list of prescription papers received by the pharmacy. Okay? For the month. Ayan. So, kapag walang mapagawa sa akin yung pharmacist ko, no, ayun yung pinapagawa niya sa akin. Ayan. So, I write in the prescription logbook, okay, the list of prescriptions. Ayan. So, ngayon, kailan lang ba kinukuha ng pharmacist yung prescription? So, of course, number one, if the prescription is intended for prescription medicines, okay, which we will discuss later on, if the prescription is already fully filled, okay, meaning to say, ang request ay 30 tablets, binigay mo yung 30 tablets, okay? Ayan, so pwede mo nang kunin yung prescription. So you may wonder, sir, edi saan magbabase yung patient ng instruction niya? That's why you need to have a pad, okay, where you write instructions for the patient. That is where you will interpret the instructions by the physician. Okay, so sinusulat mo sa isang pad yung instruction for the patient, or you use auxiliary labels. Ayan. So below Signa, there are special instructions such as the number of refills, if label is needed. Tapos ito hindi to totoo, no? Ayan. In the Philippines, bawal to. Ayan. So lagyan natin siya ng isang malaking X. Ayan. So in the Philippines, charan, ayan. Ayan. Hindi to pwede. Ayan. Yung sinusulat ninyo na do not substitute. Okay? Ayan. So, because again, we have Generics Act of 1988, physicians are required to only request, to only prescribe generic medicines. Okay? Generic names need to be written in prescriptions. Okay? Hindi nila pwedeng i-insist that patients only buy branded medicines. Okay? In the US, wala silang ganung rule. Okay. So, this is another example of a prescription. Ayan. So, this prescription is a prescription for an oral suspension. Okay? Ayan. So, let's again look at the different parts of the prescription. Of course, you have the physician information, the physician signature, and the license. The patient information, this time meron na siyang age, meron siyang weight, the date of the prescription or the date when the prescription was written. We also have the superscription, we have the inscription hanggang dito. Ayan. Remember that in the inscription, it's not only the name of the medication, but also the dose strength or the concentration of the medication should also be written. Below it, over here, okay, dispense 100 ml and give 14 milligrams per kilogram per day for 10 days. These are instructions for the pharmacist. Okay, and then we have that's what you call the subscription, and we also have Signa, which bears instructions to the patients, and we have the special instructions. Okay, ayan. So I hope it's clear already what we mean by those parts of the prescription. Now, this is another kind of prescription. Okay, so this kind of prescription is a prescription for a medication that requires compounding. Okay, again, when we say compounding, siya ay extemporaneous preparation of the medication. Upon the receipt of the prescription, the pharmacist prepares the medication for the patient, and normally it is a specific dosage form. Okay, ayan. So it's a specific dosage form for the patient. Ano yung Q? Ayan. So wait, tayo nahanap ko. Nasaan yung Q? Ayan. Okay, there. Okay, so thank you. Ayan, so my question. Okay, so I know, hindi ko kasi binasa, no? Ayan, sige na nga. Ayan, dito tayo. So this is the Signa. Okay, ayan. So the signa again bears the instructions to the patient. Okay, so again, remember that it is the signa that needs to be clarified and interpreted by the pharmacist for the patient. Okay, ayan, kasi instruction ito for the patient. Now, remember that the instruction to the pharmacist says na kailangan daw magbigay ng 14 milligrams per kilogram per day for the patient. Okay? So, dito na pumapasok yung pharmaceutical calculations. Okay? You need the weight. Oops, I'm sorry for that. Uh, ayan. So, you need to compute the amount of the medication in milliliters, okay, that needs to be taken by the patient. So, yung milliliters na yon ay i-convert mo rin sa teaspoons. Ayan. So, we will discuss more of that later, no? When we proceed to the calculations of doses. Okay? Ayan. So, ngayon, ang ibig sabihin nito is kapag na-compute mo na how many milliliters need to be taken by the patient, you will know how many teaspoons are equivalent to that milliliter. And then, ito ay yung frequency that the medication needs to be taken. Okay? So, itong Q12H, no, this is actually an acronym that stands for Kake Dodecum Oris. Ayan. So, ibig sabihin every 12 hours. Okay? Ayan. So, Q there means kake. Ayan. So, every 12 hours. Okay? So, ibig sabihin twice a day. Okay? Yan. Minsan kasi maguguluhan pa yung patient, no? Eh, sir, ano po ibig sabihin ng every 12 hours? Ay, ano lang po yan? Ibig sabihin twice a day, no? Ayan. In between my 12 hours. Okay? Ayan. So, that's why a pharmacist is really important kasi siya yung mag-explain noon. Okay? Ayan. So I hope I was able to answer that question. So Q stands for kake. It is a Latin word which means every. Okay. So, oops. Ayan. So on your right, okay, on your right, there's this prescription that is intended for compounding. Okay? Ayan. So, you will see in the inscription, there's a list of ingredients. Okay? So, the pharmacist needs to combine those ingredients and prepare the medication for the patient. Okay? Ayan. So, identify muna natin, no? So RX, again, that's your superscription. Then over here, the list, oops, and the list of medication, ito yung ating inscription. Okay, so you have metoclopramide, hydrochloride, methylparaben, propylparaben, sodium chloride, and purified water. Ayan, so QSAD stands for quantum sufficient add, meaning add sufficient purified water to make 100 ml. Okay? Ayan. So, basically, yun yung ibig niya sabihin. Okay? Ayan. So, quantum sufficient, a sufficient quantity. Tapos, add means to. Okay? Ayan. So, to make 100 ml. Ayan. So, yun yung ibig sabihin ng mga nakasulat dyan. Okay? Now, the subscription, yun yung instruction to the pharmacist, yun yung ito, MFT nasal spray. Okay? What do we mean by this? Okay? This subscription stands for Misi It Fiat nasal spray, meaning to say mix and make nasal spray. Okay? So, ang instruction ng physician is for the pharmacist to mix the ingredients and make a nasal spray. Okay? Ayan. Now, below it, we have the signa. The signa is properly written in English. Okay, so wala namang kailangan na i-interpret, no? So it's a nasal spray for chemotherapy-induced emesis. Siguro kailangan explain ng pharmacist kung ano ibig sabihin ng emesis, no? Ayan, it means vomiting, okay? Pag mayroong nararamdaman yung patient na vomiting, ayan, due to taking of chemotherapy agents, ayan, so kailangan niyang mag-take ng nasal spray. And I think ang important din dito is that the pharmacist also explains to the patient how to take the nasal spray. Ayan, so ito rin yung isa sa mga responsibilities of the pharmacist, no? Explaining how medications need to be taken by the patient. Ayan, use as directed, discard after 60 days. Ayan, so let me just give you some examples from again, no, from my medical mission experience. I remember, no, we went to Bais, no, 2 years ago, okay, and we actually brought with us a student. Okay, ayan. So in the College of Pharmacy, we also involve our students in our outreach programs and in our medical missions. Okay, we actually brought one student with us to help us in the medical mission and also to observe what pharmacists normally do in the community. Okay, kumbaga yun na yung isa sa mga unang training nila, okay, to know what it looks like, okay, dealing with patients. Now, nasa ano kasi, Visayas region yon. Ayan, so lahat kami Tagalog, no, na pumunta doon, na pharmacist, walang marunong magsalita ng Visayan language, okay? The good thing is, this student, ayan, she's also the former president of the student council, marunong siya magsalita, no? Ayan. So, ang minsan, no, we have to use the vernacular language to our patients. Ayan, yung naiintindihan nila, okay? Tapos, whenever merong prescription for meter dose inhaler, yung ginagamit ng mga nahirapan huminga or yung may asthma. Ayan. So, I asked this student to explain to the patients how to use the metered dose inhaler. Okay? Ayan. Kasi hindi ako gumagamit nun. Ayan. And pag nag-explain ako, tapos hindi naintindihan ng patient, kasi Tagalog nga ako, ayan, baka magkamali lang siya, no? So, yung student, yun yung ginagawa niya. Dine-demonstrate niya talaga how to use the particular dosage form. Tapos, another case, when I was an intern, may bumili ng Bisako din. Ayan. So, um, Dulcolax, no? Ayan. So kung familiar kayo with that drug, ayan, so you know what I mean. Ayan, meron kasing dalawang forms talaga noon. May tablet, may suppository. So the prescription is for a suppository form of the drug. Now, yung pharmacy assistant, binigay niya lang yung Bisacodil suppository dun sa patient without explaining how it's supposed to be administered. Okay? Ngayon, bumalik yung patient. Sabi niya nabulunan daw, ba't ang laki-laki ng binigay na gamot sa kanya, okay? Tapos ayan, gusto ko talagang matawa, no? Kasi may mali, no? Ayan. So we as pharmacists need to explain to the patient how this medication needs to be taken. Ayan. So dapat in-explain kasi that this is a suppository. So pag sinabi nating suppository, it is supposed to be inserted in an orifice. At dahil ito ay rectal suppository, ayan, it's supposed to be inserted in the rectum. Ayan. So, importante yung instruction to be given to the patients. Okay? Ayan. So, yun. Just remember that. Okay? Ayan. So, mga little experiences, no, that I can actually tell you. Ayan. Kasi medyo limited yung aking practice experience. Ayan. In the field of pharmacy. Okay. So, let's have a couple examples of prescriptions. Ayan. So, if you recall, I asked you to bring or to look for a prescription that you have with you. Ayan. Tapos, we will you will be presenting yung prescription na yon. Again, I will ask you to cover the name of the patient. Ayan, we wouldn't want to know kung para kanino yon. Okay? Ayan, so sige, Miss Hennessy Franny. Ayan, so and then we have si Miss Kayla Cruz. Okay? Si Miss Hennessy muna. Yeah, so can you turn on your video so that we can actually see what you are going to present? Yes. Okay. Okay, okay. Yeah, so si Miss Hennessy. Okay, nakalimutan lang din pala. Okay, any volunteer. Ayan, sino yung nakapagdala, nakahanap ng prescription na gusto nilang i-present? Yes. Are you unmuting Miss Noceda? Okay. Hindi rin. Okay. Okay. Ayan. Okay. So, dahil mukhang nakalimutan nyo na naman ako. Ayan. So, okay. So, we can do this next time. No? Ayan. So, the next time that we meet, again, I ask you to bring your prescriptions with you. Ayan, nasa to-do list natin yon ha. Ayan, so look for a prescription, okay? Then we will try to analyze the prescription. So the next time that we meet, okay, we will again look at the prescription, but this time, dadagdagan natin yung gagawin, okay? We will not only identify the parts of the prescription, but we will also interpret, okay, the writings, okay, ayan, yung mga instructions that are written in the prescription. Okay, is that clear, class? Ayan. So, no problem. Ayan. Alam ko namang with a very long time na hindi tayo nag-meet, no, pwede niyo makalimutan. Ay, hindi. Mas maganda kung galing sa inyo, no? Ayan. So, yes. Okay. Yes, pwede yung picture. Pwede yung picture. Okay. Na meron bang kahit na isa mag-volunteer or wali? Ayan. Sige, next time na lang. Okay? Ayan, no problem. Okay. So, pero ayan, meron daw. Ayan, so ayan, so let's have one. Ayan, meron daw na ready. Ayan. Yes, yes. Ayan. So I will call Mr. Jonathan Palomar. Ayan. So Mr. Jonathan Palomar. And so you just present the prescription, tapos just identify the superscription, inscription, subscription, and signa. Ganun lang. Ayan. So ito lang siya actually. Ayan. Okay? So bring out your sample prescription with you and identify the following parts. And another question is the prescription easily understandable by a customer or a patient? Okay? Ayan.
Sir?
Okay, ayan. So we have now, I will spotlight you. Ayan. Okay, so thank you. You may cover the name of the patient. Ayan. We wouldn't want to know kung para kanino yan. Okay? Ayan. So what you are going to do is just to identify the superscription. Ayan. So where is the superscription? Ayan.
Ito, sir.
Okay, ayan. Ay, thank you. Next, inscription.
Inscription po,
I didn't get that. Could you try again?
Okay. That's actually ciprofloxacin. Okay, ayan.
Ayun, sir.
So, ayan. So, ciprofloxacin, teka lang, hindi ko rin nakikita eh. Nasa kabilang laptop. Okay, there. Ayan, nakikita ko na. Okay, so ciprofloxacin. Okay. Ano
Inscription
pa
po,
yung
sir.
isa pang part ng inscription? Aside from the name of the medication, ano pa dapat? Dapat naka-identify din yung
Dose po.
correct. Ayan. So the dose is also written. It's 500 milligrams. Ayan. Ayan. 500 milligrams but parang may kudkudlit lang doon. Okay. Okay, next ay yung subscription.
Ito ba, sir?
Okay, so subscription.
Wala, parang
Actually,
wala, sir.
yun lang, yung ito siya. Yung number 14, okay?
Ito, sir.
Yes, yan na yung instruction to the pharmacist, okay? Paano naging instruction yan sa
Paano yun,
pharmacist?
sir?
Okay? Kasi the number sign indicates the number of capsules or tablets or kung ano man yun that needs to be dispensed by the pharmacist. Okay? So siya na yan. Yan na yung ating subscription. Okay? Number 14. Okay? Ayan. So next is the signa, the instruction to the patient.
Ito, sir.
Okay, correct. So, yung nakasulat ay 1 tablet 2 times a day for 7 days.
7 days.
Okay, ayan. So, yan yung nakasulat na signa. Okay, so si Mr. Palomar, do you easily understand or is the prescription easily understandable by the patient?
Medyo hindi, sir.
Oo, no? Ayan. So, in your opinion,
Dahil
medyo hindi.
dun, sir, dun sa 14, and dun sa gamot, sir, medyo hindi alam yung sulat.
Okay, okay. So, thank you for that example, Mr. Palomar. Ayan, so now you can see, no, closely, parang minsan nanguhula lang kami, mga pharmacists, kung ano yung nakasulat dun sa prescription, okay? But actually, the reason is we have experience and we know the different drugs that are normally prescribed by physicians. That's why we can actually interpret the name of the drug and identify yung mga hindi masyadong maintindihan in a prescription. Okay? Ayan. So this class is an example pala of a prescription that is fully filled. Ayan. Kaya may nakasulat na -14.0. Ibig sabihin, binili niya talaga yung lahat ng tableta. So wala nang refill ito. Ayan. So thank you so much for that, for sharing that, Mr. Palomar. Ayan.
Welcome, sir.
Okay. So,
Here's what I
ayan. So,
found.
okay. So we'll just have some more of these, no, later. Ayan. Mas masaya yung susunod, no? Kasi sa susunod, teka lang, paano spotlight. Okay. Ayan. Okay. So, next time kasi we'll actually interpret, okay, those that are written in the prescription. Okay, so just keep your prescriptions with you. We'll have some more examples. Okay, now what are medication orders? Okay, medication orders are actually similar to prescriptions because they bear the medications for the patient. No? They bear the list of medications for the patient. However, medication orders are normally found in hospitals and other healthcare institutions. Okay, medication orders also bear instructions how medications are supposed to be administered by the nurse or any other appropriate healthcare professional in the hospital or in any other healthcare institution. Okay, ayan. So what you see on the right is actually an example of a medication order. So this is a hypothetical medication order. Ayan, so we still have the same parts. Okay, so we have the patient name. Okay, we also have, yeah, we also have the list of the medications, ayan, and how medications are supposed to be administered. Okay, there are special instructions sometimes, okay, in your medication order. However, again, I would like to reiterate that in the Philippines, it's not allowed to write no substitution, okay, or no generic substitution, because we are bound by law, okay, na generic dispensing and generic prescribing, which I will describe later on. Now let's just interpret some of these things that are written in your medication order. Okay, ayan. So we have here in the first line, okay, nakalagay dyan yung pangalan ng gamot. And this is propranolol. Okay, propranolol is actually a beta blocker. Ayan. So it is a medication used for hypertension normally. Ayan. Kaya nga sabi ko sa inyo kanina, wag niyong ipakita sa akin yung ano, yung pangalan, no? That's another thing, okay? As you learn things in pharmacy, you will actually have a scientific guess, okay? So medyo malalaman nyo ano yung condition ng patient, okay? But of course, you are not supposed to judge, okay? It is unethical to judge a patient, okay? So, siguro, kaya mo lang kailangan ma-identify kung ano yung iniindang condition ng patient. It's for you to know what questions to ask to the patient. Okay? Ayan. So, para alam mo kung ano yung information which you still need to know. Okay? Ayan. So, for example, here, I see a lot of medications na para sa hypertension. Okay? So, one is beta blocker, propranolol, ayan, 40 milligrams. Now, yung nakasulat dito na mga acronyms. Ayan. So, PO stands for per orem, and QID ay kaki NDE. Ayan. So, ibig sabihin, propranolol, 40 milligrams, um, taken by mouth or orally. Ayan. Sorry, hindi kake. Katur indie. Ayan, I'm sorry for that. Katur indie, 4 times a day. Okay, so QID. Okay, quarter or quatur indie. Okay, so we'll discuss more of Latin later on. Now, how would interpreting prescriptions and medication orders be different? Okay, let me go back to the previous slides. Ayan. So, remember na for prescriptions, the signa bears instructions for the patient. So, ito yung sasabihin mo sa patient. So, for example, here, the signa is 2 teaspoons every 12 hours until gone. Okay? How would you now interpret the signa to the patient? Ang sasabihin mo is, take 2 teaspoonfuls every 12 hours until the medication is gone or until it ubos na, no, yung gamot. Ayan. So basically, you add a verb. Okay? Now, the verb that you normally place is take. Okay? Kasi instruction yun sa patient. Okay? So the patient needs to take 2 teaspoonfuls. Okay? Let's say, meron ka dyan na eye drops. Okay? Eye drops. Normally, ang ginagamit natin na verb for the signa kapag eye drops ay instill. Okay? Or administer. Okay? Yan. Pwede either. Instill kasi maglalagay yung patient ng drops. Okay? Sa kanyang mata. Now, for medication orders, remember that the instructions here are intended for a healthcare professional. Hindi siya yung iinom. Okay? Yung magbabasa ng notes na ito ay hindi patient. Ang magbabasa nito ay healthcare professional. So, in interpreting those written in a medication order, ang sinasabi natin ay administer. Okay? Ayan. So, hindi natin sinasabing take propranolol. Okay? Ayan. So, I hope I made it clear. Ang verb na ginagamit natin dito is administer. So, for example, in line number 1, it's administer 40 milligrams of propranolol orally 4 times a day. Okay? In the second line, this one naman ay isang diuretic agent, no? Ayan, furosemide. It helps also relieve yung hypertension or sometimes kapag may heart problem, congestive heart disease yung patient, no? Ito yung combination ng gamot na iniinom niya. So malamang either hypertension or CH dito. Ayan. So next, in second line, we interpret it like this, okay? Administer 20 milligrams of furosemide orally every morning. Okay? Ayan, basahin natin siya in Latin. Furosemide, 20 milligrams per orem kake ante meridiem. Okay? So, yung per orem means orally and QAM ay kake ante meridiem. In the third line, ang nakalagay naman dyan ay florazepam, 30 milligrams at ora somni prorenata sleep. Okay, so ano yung ibig sabihin nun? Administer 30 milligrams of clorazepam at bedtime o obvious naman, no, ora somni during time of sleep. Okay, ayan, or at bedtime. At bedtime, prorenata means as needed or as necessary for sleep. Ibig sabihin, yung florazepam ay pampatulog. Okay? If the patient is not able to sleep because of the condition that he or she is feeling, okay, then the patient needs to take florazepam. Okay? But again, this will be administered by a nurse normally. Okay, in the fourth line, okay, we have D5W. D5W is actually 5% dextrose in water. Tapos dadagdagan daw ng 20 milliequivalents ng potassium chloride, mali yung pagkakasulat ng KCl, per liter. Okay, ayan. So, at 84 milliliters per hour, that's the rate. Then below it, you have the name of the physician. Okay, so now let's move on to a topic that is quite close to what you will most likely encounter with your relatives, your friends who will know that you are a pharmacy student. Okay, ang katanungan na same lang ba ang effect ng generic at ng branded? Okay? Ayan. So, laging yan yung katanungan. Okay? Now, I would like to say that before we proceed, no, there's actually the Administrative Order number 62, series of 1989, which specifies rules and regulations to implement prescribing requirements under the Generics Act of 1988 or Republic Act number 6675. Now, in that AO number 62, series of 1989, it's defined what are the different types of drugs, okay, based on their requirement of prescription. Now, we have prescription drugs, also known as ethical drugs. Now, these are the drugs that require, okay, prescriptions. Okay, so these are only dispensed upon written order of a validly registered licensed physician, dentist, or veterinarian. Now, prescription drugs are most often used for the management or treatment of a condition or a disease. Okay? For example, antibiotics. Okay? So, antibiotics need prescriptions. Okay? Only very recently was it actually implemented very strongly na you are not allowed to buy antibiotics, okay, from establishments like Sari-Sari Store or 7-Eleven or Mini Stop. Yan, kasi nga, these are already prescription-only medications. Okay? Hindi sila pwedeng i-dispense without any written order from a physician. And yung dahilan doon, it's because talamak na, no? There's an increasing evidence of antimicrobial resistance due to irrational use of antibiotics. Okay? Now, some other examples of prescription drugs are those that are for the treatment of hypertension, diabetes, hyperlipidemia, and many more. No? Ayan. So, different conditions. Ayan. Um, even those that you need for um, proper sleep. Okay, ayan. So, they are also prescription drugs. Now, there are also the OTC or the over-the-counter drugs. These are the non-prescription or over-the-counter drugs. Ayan. They do not require prescriptions from a validly registered licensed physician, dentist, or veterinarian. And OTC drugs are only for prevention and symptomatic relief of minor or self-limiting ailments. So what are examples of these? For example, yung mga analgesics that you can buy from drugstores or from other establishments, which I mentioned before, like Sari-Sari Store or 7-Eleven or Mini Stop. Okay? Yan, yung mga paracetamol, yung ibuprofen or combination of this, ibuprofen, paracetamol, even mefenamic acid, although there is a limit, okay, doon sa mefenamic acid that you can actually buy from a drugstore. And those that are used for symptomatic relief of cough and colds. Okay, so let's say carbocysteine, Ambroxol, guaifenesin, Lagundi, or yung ginagamit ninyo na chlorpheniramine, phenylpropanolamine, phenylephrine, etc. No? So those are some examples of non-prescription drugs. Again, they do not specifically treat a condition. They are only for symptomatic relief of minor or self-limiting ailments. Ayan. Now, even vitamins and food supplements are also OTC drugs, okay? Ayan, or OTC products, okay? Hindi sila kailangan ng prescription. But I need to say something about vitamins and food supplements, okay? Now, do you need vitamins and food supplements? Ayan. So, I see a response. Yes, may sumagot. Yes, okay. Ayan. So, may sumagot ng no, okay? Ayan. So, what's the general consensus by healthcare professionals about this? Well, in the first place, you don't need, okay, vitamins and food supplements when you are eating well, when you have a healthy and balanced diet. Okay? Ayan, correct. Ayan. So may sumagot dito, depends po on your diet. Correct. You don't need vitamins. Okay? Ayan. You only need vitamins if you have a deficiency. Now, why am I telling you this? Kasi what happens is, most of the time people over-medicate. Okay? So, kunwari, iinom ng 1 gram of ascorbic acid, that's vitamin C, 3 times a day. Eh, kumakain naman sila ng tama. Okay? Kumakain naman sila ng fruits and vegetables. Okay? Um, ano yung nangyayari doon sa excess na vitamins. Okay? Now remember, especially for water-soluble vitamins like your vitamin C, vitamin B complex, ayan, they are not stored by the body. They are only excreted by the body when you don't need them. Okay? Now, vitamins are needed as cofactors in your body, okay, or coenzymes in your body para normally function yung enzymes in our body. But if you are eating well, then you get these vitamins very well at their right amounts. Okay? Now, if you have a particular deficiency, okay, let's say, meron kang problem with your gums. Okay? Ayan. Vitamin C deficiency results in certain gum problems or pag mahina yung buto mo, brittle yung bones, ayan, it could also be because of vitamin C deficiency. So that's the only time that you need to actually take these vitamin. Otherwise, you don't. Kasi what you will get after drinking or taking more than the necessary vitamins ay expensive urine. Okay? Ayan. So, I don't know if you look at your urine. Okay? Tingnan niyo yung ihi ninyo kapag umiinom kayo ng vitamins. Ano yung kulay nila? Normally, they are correct, no? They are orange, okay? Or yellow to orange, no? Golden yung itsura niya. So bakit? Kasi nandoon yung ininom mo. Okay? So imagine yung binili mong gamot, okay? Binili mong vitamins, doon lang napunta sa ihi mo. Kasi hindi mo naman pala ginamit. Okay? And there are also certain vitamins that can cause toxicity. For example, vitamin A and vitamin D. Okay? Now, these are lipid-soluble vitamins. And because they are lipid-soluble, they get to be stored in the body. They accumulate in the body. So, let's say, lumalabas ka naman ng bahay. Okay? Naarawan ka naman. Do you know that the inactive form of vitamin D is in fact in your skin? Now, pag lumabas ka sa bahay, that vitamin D will be activated and pag na-activate siya, yun yung ma-absorb ng body mo and yun yung gagamitin ng body mo to absorb calcium efficiently. Okay? Ayan. So, pag lumalabas ka man naman ng bahay, you don't need vitamin D. Okay? Kasi pwede ka magkaroon ng vitaminosis D, okay? Pag nasobrahan yung vitamin D na iniinom mo. Okay? Ayan. So, just words of advice. Okay? Do not, even if these are OTC products, okay? Hindi dapat sila inaabuso. Okay? Kasi maaari itong makasama sa'yo or baka makasama sa bulsa mo. Okay? Yun lang naman yun, yung dalawa. Another is food supplements. Ayan. Doon tayo sa food supplements. Yung food supplements, in the first place, they do not have approved therapeutic claim. Okay? Anong ibig sabihin nun? They did not undergo a series of clinical trials that prove that they are effective for whatever that they claim they are effective for. Okay? Ayan. So, wag kayong magpapaniwala sa mga commercials. Okay? Ayan, kasi those are marketing strategies only. Okay? Again, what happens to you when you take these food supplements but you are eating well? Nagsasayang ka lang ng pera. Okay? Ayan. So, please use, yun, sayang kasi, no? Ayan. Correct, no? Laging nakalagay sa dulo ng commercial ng food supplements, ito ay hindi gamot at hindi maaaring ituring na gamot at hindi nakakagamot ng mga kondisyon, something, no? Yeah, so no approved therapeutic claims, okay? Ayan, so yun lang yung mga words of advice ko that I can actually introduce here. Another thing that I would like to say is that prescription drugs are not allowed to be advertised. Okay? So, pansinin nyo class, wala kayong dapat makita in the television, or marinig in the radio na commercial for prescription drugs. Kasi bawal yon. Okay? Ayan. So, you only hear about OTC drugs or food supplements and vitamins in commercials. Okay? Kasi yun yung allowed by law. Okay? Just like professions, okay? Hindi rin pwedeng i-promote ang profession. Kunwari sasabihin mo, ako ay isang dentista. Ayan. Tawagan niyo ako sa number na ito. Okay? Ayan. That is also not allowed by law. Okay? But you can promote your product or a specific service by your clinic. Okay? Pwede yon. Pero yung ipopromote mo yung sarili mong profession, that's also not allowed by law. Okay? Ayan. So, medyo nasingit ko lang. Now, there's also dangerous drugs. Okay? Dangerous drugs, either refer to prohibited drugs, ibig sabihin bawal sila at any case, or regulated drugs. Okay? So example of prohibited drugs are those that you see on the left. Ito yung opium poppy, okay? Which is the source of your opiate drugs, okay? Tapos yung nasa gitna, that's your cannabis sativa. Ayan. So yan naman yung source of marijuana, okay? Source ng THC, tetrahydrocannabinol, and cannabidiol. Now, there's a lot of talk about medical marijuana, okay? Ayan, so we will not dive into that, but here's my take on it, okay? There's actually many evidence that cannabidiol, a specific component of um, cannabis sativa or cannabis indica, is actually helpful in alleviation of cancer pain, okay, and many more ailments, no? Even autism, meron din daw siyang evidence that it supports the treatment or the management, not treatment, no? We don't treat that. The management of conditions, behavioral conditions like that, okay? Now, the problem with criminalization of these substances is that hindi siya nakakarating sa mas maraming tao. And we don't get to regulate the components of these potential medicines. Okay? The more that you legalize one thing, the more that you can actually regulate it and prevent any untoward incidents to people. Okay? So yun yung point ng iba who are actually pushing for legalization of certain prohibited drugs. Okay? There are actually lots of documentaries that you can actually watch on Netflix about that, no? Ayan. So you can search for those. Medyo interesting yung mga insights nila. Now, pag sinabi namang regulated drugs, ibig sabihin, ito yung mga gamot just like your diazepam, mga sleeping aids, anti-anxiolytics, antipsychotics, etc. No? For example, Adderall, okay, is actually amphetamine. Okay, it is closely related to what we know as shabu, which is methamphetamine. Okay, now it's a regulated drug kasi meron siyang particular use in medicine. Okay, but before this drug is dispensed, kailangan siya ng special prescription form. And only physicians with a special license can actually prescribe these kinds of medications. Okay? Ayan. So, aside from these three, prescription drugs, OTC drugs, and dangerous drugs, we also have a fourth criterion according to the latest Republic Act. Okay? And ito yung pharmacist-only prescription medicines. Okay? Ano yung pharmacist-only prescription medicines? Basically, these are medicines which are OTC. Okay? Ayan, OTC drugs sila, but they are required by law to be dispensed only in the presence of a pharmacist. Anong ibig sabihin nun? These medications, the pharmacist-only OTC medications, ayan, sorry, mali yata yung nasabi ko kanina. No? Pharmacist-only OTC medications, ayan. So, these are medications that you should not find in establishments like 7-Eleven, grocery, or mini stop. Okay? Ayan. Kasi 'di ba, kapag ikaw may lagnat, okay, saan ka unang tumatakbo? Sa pinakamalapit na sari-sari store. O kaya kung may 7-Eleven na malapit or mini stop or may Pure Gold na malapit, doon ka pumupunta to get these OTC meds. Okay? There are certain OTC meds which require the presence of the pharmacist. Okay? And you will discuss more of these now when you go to dispensing class. Okay? Which I will no longer elaborate on. Ayan. So, puntahan natin to. Ayan. I have only 3 minutes. Ay, so, generic prescribing and generic dispensing. Basically, ang sinasabi dito is that required by law that physicians write the generic name or the generic terminology of the drugs that they prescribe. They may place the brand name, but they are not supposed to require pharmacists to dispense only the branded medication. Okay? Because merong kaakibat na generic dispensing. Meaning to say, when the patient goes to the pharmacist, the patient is given liberty to choose from the different generic equivalents of the drug, okay, which are most likely cheaper, okay, and not to buy the branded medicine, okay? Ayan. So yun yung essence of generic prescribing and generic dispensing. Now, when you say generic equivalents, ang ibig sabihin nun, these are drugs having the same active ingredients, the same dosage form, and the same strength of the drug. Okay? Now, you may ask, okay, sir, totoo bang mas effective ang branded kaysa sa generic dahil mas mahal ang branded kaysa sa generic? Baka naman kasi mas murang ingredients yung ginamit at less effective ang generic drugs. Well, here's my answer to it. Okay? We have regulations that ensure that generic drugs have the same effectiveness as branded medicines. Okay? Now, why are branded medicines more expensive than generic drugs? It's because, okay, branded medicines undergo a lengthy research and development process, including a very lengthy clinical trial. Okay? So, nag-undergo sila ng 4 phases of clinical trial. Phase 1, Phase 2, Phase 3, Phase 4. And in all of these processes, gumagastos yung isang innovator manufacturer. Okay? Yan. So, let's say, for example, yung Lipitor. It's manufactured by Pfizer. Okay? So, yung Pfizer, gumastos sila ng malaking-malaki for the research and development of atorvastatin to be made into a drug that they named Lipitor. So, to give innovator manufacturers a head start and for return of investment nila, okay, they are given a patent. However, after the patent expires, other manufacturers can now manufacture generic equivalents of the drug. Now, do generic drugs need to undergo the same research and development process? The answer is no. The R&D process takes about 15 years. Okay? The patent is normally 15 to 25 years. Okay? Now, pag expired na yung patent, pwede nang mag-manufacture yung ibang manufacturers ng generic drugs. Now, because wala na silang R&D, mas mapapamura nila yung gamot. Okay? And another thing that makes branded medicines expensive ay yung advertisement. Okay? Marketing costs. Yung generic drugs normally don't shell out money for marketing. Okay? Kasi they don't need it. Okay? Meron ng recall ng name of the drug from their patients or the physicians. Dahil existing na sila in the market. Okay? Ayan. So, hindi na nila kailangan nun. But, generic drugs require, ayan. So, last 2 minutes. Okay, so, generic drugs only require what we call BABE. Ayan, I will just type it in the chat box. BABE stands for bioavailability and bioequivalence. Ayan. So ito yung ina-undergo nila na test. Okay? BABE tests or bioavailability and bioequivalence test. Now, before a generic drug gets approved by the Food and Drug Administration, they should prove that they have the same safety and effectiveness as their innovator counterpart. Kaya kailangan nila ng bioavailability and bioequivalence tests. Okay? Ayan. So, we'll actually continue our discussion next time kasi this is actually quite an interesting discussion. And if you actually watched the replay of the webinar or if you were able to attend the webinar last Friday, medyo napag-usapan yung tungkol sa generic drugs. Okay? Ayan. So, before we proceed to our next topic, we'll look back on this and pero meron ako announcement, class. Ayan. Okay, before we end formally, I think I would need one. Okay, ito na, makeup class. Okay. I would like to know who is your point person. Ayan. So that I will ask the point person kung ano yung most available time for us to have a makeup class. Okay? Ayan, si Althea. Okay, so noted. Ayan, so I'll message Althea. Ayan, perhaps I'll be using the ILS Cloud to message you. Then, actually nakikita ko na time kasi I know that medyo busy yung ano niyo, no, yung schedule niyo. I studied your schedule actually. I wanted to have the makeup class ng before this class, no? Ang plano ko sana is magklase tayo ng earlier, ayan. Maaga tayo mag-start. Ayan, tapos kumbaga hindi natin kailangan ng isang full session. Okay? Kaso bigla ko nakita schedule ninyo, may klase kayo ng before this. Okay? Ayan, so baka wala naman na kayong hinga, di ba? Ayan, so siguro we'll just schedule it. I'll be coordinating with Miss Althea. Ayan, for our one makeup class that I will ask. Okay? Ayan. So, and I hope may mga natutunan kayo for today. Okay? If you have questions, I think I have one more minute. Ayan. 11:04 na. Ayan. But I'm okay, no? If you are okay. Ayan. So, if you have questions, just type in your questions in the chat box or just raise your hand. Okay. So, there's actually a question. Okay. Okay, so what I actually did in the learning module is you are not allowed to go back to a previous section. I look into it, no? I think you can go back to the front page. Tapos, once you click again yung lesson module, tatanungin ka naman if you are going to restart yung pag-view mo or not, no? Ayan. So, kasi when I preview the lesson module, ganun ko siya ginagawa, no? So, but I think no, for the next learning modules, I will put a back access, okay, para pwede kayong umatras. I have also uploaded the slides in the ILS Cloud. Ayan. So you can browse through the topics that we will discuss. Ayan. Para if you have questions in mind, you can already address them to me, no, during our synchronous discussions. Okay? So with that, I thank you all. Ayan. And I will no longer keep you any longer because I know that you have another class. Okay, after lunch. I'll see you again next week, and we might have a makeup class, if not this week, next week. Okay, so thank you very much, one and all, and I hope you are safe and well in your homes. Okay, so I'll see you again. Bye.
Bye, sure. Thank you.
Bye bye. Thank you, guys and girls.
Thank you po, sir.
Thank you.
Thank you po.
Thank you, guys.